Oxycodone is an opioid used in the management of moderate to severe pain. In this video, let's found. What is oxycodone? What is oxycodone used for? Contraindication. What are the side effects of taking oxycodone? How does oxycodone work? How to use oxycodone? What is oxycodone? Oxycodone, sold under various brand names such as Roxicodone and OxyContin, is a semisynthetic opioid used medically for treatment of moderate to severe pain. It is highly addictive and is a commonly abused drug. It is usually taken by mouth, and is available in immediate release and controlled release formulations. It is on the World Health Organization's list of essential medicines. In 2020, it was the 54th most commonly prescribed medication in the United States, with more than 12 million prescriptions. What is oxycodone used for? Oxycodone is indicated for the treatment of moderate to severe pain. There is also an extended-release formulation indicated for chronic moderate to severe pain requiring continuous opioid analgesics for an extended period. Contraindication. Oxycodone therapy is contraindicated in patients with respiratory depression, bronchial asthma, in unmonitored settings, hypercarbia. Side effects. Common side effects include euphoria, constipation, nausea, vomiting, loss of appetite, drowsiness, dizziness, itching, dry mouth, and sweating. Side effects may include addiction and dependence, substance abuse, irritability, depression or mania, delirium, hallucinations, hypoventilation, gastroparesis, bradycardia, and hypotension. Pharmacodynamic. Oxycodone acts directly on a number of tissues not related to its analgesic effect. These tissues include the respiratory center in the brainstem, the cough center in the medulla, muscles of the pupils, gastrointestinal tract, cardiovascular system, endocrine system, and immune system. Oxycodone's effect on the respiratory center is dose-dependent respiratory depression. The action on the cough center is suppression of the cough reflex. Pupils become myopic or decrease in size, peristalsis of the gastrointestinal tract slows, and muscle tone in the colon may increase, causing constipation. In the cardiovascular system, histamine may be released, leading to pruritus, red eyes, flushing, sweating, and decreased blood pressure. Endocrine effects may include increased prolactin, decreased cortisol, and decreased testosterone. It is not yet known if the effects of opioids on the immune system are clinically significant. Mechanism of action. The full mechanism of oxycodone is not known. Under conditions of inflammation or hyperalgesia, opioid receptors in the heart, lungs, liver, gastrointestinal tract, and reproductive system are upregulated and transported to nerve terminals. Oxycodone and its metabolites, neuroxicodone, oxymorphone, and neuroxymorphone are opioid agonists. These compounds passively diffuse across the blood-brain barrier or may be actively transported across by an unknown mechanism. Oxycodone and its active metabolites can selectively bind to the mu opioid receptor, but also the gamma and delta opioid receptors in the central nervous system and periphery, and induce a G protein-coupled receptor signaling pathway. Activation of mu opioid receptors inhibits N-type voltage-operated calcium channels, inhibiting responses to pain. Half-life. The apparent elimination half-life of oxycodone is 3.2 hours for immediate-release formulations and 4.5 hours for extended-release formulations. Neuroxicodone has a half-life of 5.8 hours, oxymorphone has a half-life of 8.8 hours, neuroxymorphone has a half-life of 9 hours. Dose. For moderate to severe pain. Patients who are not taking narcotic medicines. Adults, at first, 5 to 15 milligrams, mg, every 4 to 6 hours as needed. Your doctor may adjust your dose as needed. Children, use and dose must be determined by your doctor. Patients switching from other narcotic medicines. Adults, the total amount of milligrams, mg, per day will be determined by your doctor and depends on which narcotic you were using. Your doctor may adjust your dose as needed. Children, use and dose must be determined by your doctor. Safety advice. One exception is oxycodone, which is currently classified in Category B, indicating no evidence of harm to the fetus from animal studies and the absence of well-controlled human studies. That's all the information about oxycodone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.